Welcome to the Simplified Clinical Dental Guide by Dr. Maher Mahdi Saleh Al-Rubai. In this video, we'll walk through everything you need to know about composite fillings and crown preparation, from materials to techniques, based on real clinical practice. Whether you're preparing for your clinic rotation or final exams, this guide is designed to make complex procedures simple and memorable. Let's start with the basic materials used in composite restorations. First, etchant phosphoric acid, usually 35-37% concentration, removes the smear layer and prepares the tooth surface. Next, the bonding agent, which creates a strong adhesive layer between the tooth and the composite. Then comes the composite resin itself, an aesthetic material made of resin matrix and filler particles. Finally, finishing polishing materials are essential to restore the natural shape and shine of the tooth. Clinical tip: apply etchant for 15 seconds on enamel and 10 seconds on dentin. After rinsing, the enamel should look chalky white. That's your sign it worked. And always polish well. Poor polishing leads to staining and gingival irritation. Now let's talk about two major bonding systems. Total edge system. You apply acid first, rinse thoroughly, then apply the bonding agent. It gives the strongest bond to enamel but requires excellent moisture control. Ideal for both anterior and posterior teeth. Self-etch system. No separate acid needed. The bonding agent contains the etchant. It's less irritating to dentin and reduces post-operative sensitivity. However, it has a weaker bond to enamel, so consider selective etching when needed. Remember, choose total etch for high-quality restorations and self-etch when moisture control is challenging. Composite resins come in three main types: microhybrid, medium-sized filler particles, good strength and medium polish, best for posterior teeth. Nanohybrid, nano-sized particles, offers high polish and excellent wear resistance, ideal for both anterior and posterior use. Bulk fill can be placed in 4-5 mm increments without layering, saves time, and is perfect for deep posterior cavities. All composites are applied in layers and cured using blue light curing light. The key is to follow manufacturer instructions for optimal results. Now let's review the essential instruments and burrs for cavity preparation. Round burr, spherical shape used for initial cavity opening. 330-245 burr. Pear shape, ideal for class I and II preparations. Tapered fissure burr. Tapered design creates vertical walls with slight taper for retention. End cutting burr. Cuts at the base used to flatten the cavity floor. Don't forget these required clinical tools: mouth mirror, explorer, cotton pliers, spoon excavator, matrix band plus wedge, articulating paper, and polishing brushes. Pro tip: always use a matrix band and wedge in class 2 restorations to ensure proper contact and prevent overhangs. For class I occlusal surfaces, depth 1.52 m, walls should be straight, perpendicular to the pulp. Use round and 245 burr. For class 2, proximal surfaces, requires removal of interproximal tooth structure. Always use a matrix band and wedge to recreate the contact point. Avoid overhangs, excess material, and open contacts, gaps. They lead to plaque buildup and gum disease. Walls should be tapered inward for better retention. Here are the key terms you must remember: smear layer, debris left after cutting blocks, bonding must be removed. Hybrid layer, the bonded interface between dentin and adhesive, critical for success. Cavo surface margin, the junction between the cavity wall and tooth surface must be sharp and clean. Overhang, open contact, common mistakes, check with floss. Composite fillings are not just about filling a cavity, they're about precision, aesthetics, and long-term health. Follow the steps carefully. Respect the angles, use the right materials, and never skip polishing. This guide is based on the teachings of Dr. Maher Al-Rubaii, your trusted clinical mentor. Stay confident, practice daily, and always aim for excellence. Thank you for